People ask, well, what constitutes very frequent nosebleeds? I would really defer to the patient. And if these nosebleeds are severe enough that it's troublesome for the patient or upsetting or worrisome or interfering with any normal daily activities of life or a normal quality of life, it's worth seeing a specialist. Most Americans are familiar with nosebleeds. Most people have a child who has had a nosebleed, and about 60% of the US population will have a nosebleed at some point in their life. For the vast majority of those patients, nosebleeds are self-limited, which means they either stop on their own or they are isolated, so it doesn't become part of a recurrent or a chronic problem. If somebody is getting recurrent or chronic nosebleeds, that alone is reason to see a doctor and to consider seeing an ENT or an ear, nose, and throat specialist. Most nosebleeds don't present a major issue for patients, but when they are severe, they can be life-threatening. And when they are frequent, they can really get in the way of somebody's normal daily activities, their normal work, their normal social life, and have a significant hindrance to having a normal and healthy quality of life. The way I try to quantify blood loss with patients in terms that everybody can understand is whether or not a nosebleed is severe enough to fill up a cup with blood. If a nosebleed is getting a few tissues wet and you have to use a couple different paper towels or a tissue and then eventually it stops, that might feel like a lot of blood, but in terms of the body's volume of blood quantity, that is not really a severe nosebleed. When a nosebleed is severe enough that it's like a leaky faucet dripping from the nose, nothing is stopping it, medical attention is required. And that might mean a trip to the emergency room or a trip to a primary care doctor's office. Then we are in the territory of something where urgent medical attention is necessary. And occasionally these can turn into life-threatening emergencies.